Hello, everyone. I'm Jamie Bearse, President and CEO at Zero, the End of Prostate Cancer.
Hi, guys. I'm Colony Brown, Senior Vice President of Marketing and Communications, and we're coming to you today with a very important message. And it's really personal, right, Jamie?
Yeah, it almost sounds crazy and foreign in my head to even say this, but last week I was diagnosed with COVID-19 virus, and it's been like 9 days since I came down with symptoms from it, and 7 days since I was really diagnosed with it. And it's just so crazy. It's last Tuesday, it was during the day, and my temperature jumped about 6 degrees in about 3 hours. And when that had happened, I just knew in my heart that I had just become like one of over 800,000 people so far in the United States that had gotten the coronavirus. And even in working in the healthcare community for almost 20 years now, my wife and I really scrambled to try to find what to do, what action to take, and to try to decide, like, okay, should I just like wrap myself in saran wrap and close myself in the bedroom, or call the doctor, or go to the ER or whatever. But we elected to wait it out overnight and really Tylenol it up all night long. And it was fortuitous because I had just read an article that had talked about that doctors at Massachusetts General Hospital, and then another hospital in Long Island, I think it's Long Island Jewish Hospital, had started the technique of putting COVID patients on their stomachs to help with their breathing. So tried to sleep all night laying on my stomach, and then the next morning got up with some chest tightness, and called the doctor's office, my local doctor's office, and set up a telemedicine appointment, and went from there.
I remember, Jamie, when we got that initial message that you had been diagnosed, and we were all just floored, to be honest. But we're really glad that you are 7 days out from your diagnosis, and that's why we're talking to you now, so that you can share and really be able to help others can benefit from the insights that you have, clearly. So now that we know you're okay, we need to ask about your family. I mean, you're in a household shuttered like everyone else with your family. So how are you trying to keep them safe? What kind of protocols are you taking? If two boys, a tween and a teenager, right?
That's right. Yeah, it's a challenge. It's tricky. We live in a split level house, so everybody else is on like one floor and I'm on the other at all times. We have plenty of Lysol wipes. Sometimes periodically we open the windows or open the doors or whatever to get some fresh air in to blow things out. And I've got my mask here. I know, isn't this like so pretty? So I put this on and get to wear that around. And it's a little tight, almost makes me look like a chimpanzee a little bit because my ears stick out. But it's got the lining on the inside of it that you would find at a medical office, like one of those blue things in there to help keep everything contained. So, and washing my hands. I mean, I think I told some people the other day that I'm washing my hands so much that I think I uncovered like a tattoo from a Cracker Jack box, like from when I was 10. So we're really trying to wash our hands as much as possible. And yeah, you're right. Feeling better right now. Like the biggest symptom for me is just fatigue. As I was telling you earlier, like to get up in the morning, I feel like I need like somebody to swirl a bucket of ice water over my head to threaten me to get up out of bed, get up and get going in the morning. But I'm fortunate compared to so many others and what they've gone through. Of course, thousands of people have lost their lives to this, and many more have very debilitating symptoms that go on for a lot longer. So my heart really goes out to them, and all of the people on the front lines of this, especially the nurses and healthcare workers that are working in public hospitals, that are working in assisted living facilities, or essential workers out there that are, stocking up the shelves at the grocery store so we can, get, be able to provide for our families. So that they're really the heroes in all of this. And my experience, I tried to thank everybody that I ran into throughout my diagnosis in a couple of the doctor's offices that I had to go to last week. And everybody is all decked up, and you can only see like their eyes because they all have their their personal protective equipment on, and it just looks like something out of a science fiction movie. But I tried to thank all of them that I came in contact with, because they're the real heroes. And I actually had to go through a chest CAT scan to make sure that I wasn't building up too much, and that I didn't have any fluid in my lungs or anything like that, or there was concern of maybe that I'd have a pulmonary embolism at one point. So I had to have a chest CAT scan done, and all I could think of was when I was laying on the bench to go through the machine was, imagine if I was a prostate cancer patient right now. Like, what would that be like? Would I even take the measures to go in and be seen for this, or would I, try to really tough it out and be home out of fear of making my prostate cancer symptoms or what I was going through with prostate cancer worse, or should you go in and take like immediate action, because staying at home would make it worse. I could just imagine those who have like a immune compromised systems, or just fighting the disease on the conundrum that they go through trying to decide what to do.
Jamie, even though you did go to to a medical facility, you were able to do your initial appointment through telemedicine, which probably was great because you didn't have to leave your house and they could talk about your symptoms. Kind of walk us through that, because I think that gives some comfort to prostate cancer patients who are very worried, as you just said, about compromised their immune systems and having to go out. So telemedicine has really exploded during this time. Talk about that.
Yeah, and I think that's the way the world's going to be going. I mean, that's going to be the new normal even after this virus is long gone. And credit to that too. I mean, I talked to a nurse navigator on the phone, nurse practitioner, and he was amazing of answering all my questions, willing to stay on the phone for as long as I needed to on answering questions, and sort of talk me through like what the what the process was going to be like, and we'll get into some of that. But one of the things that he said is that I fortunately didn't have really any respiratory issues like many other people that have serious complications too. Like I wasn't hacking up a lung. I wasn't coughing really a lot at all. It wasn't really short of breath. So his the most graceful thing from that conversation was really peace of mind of like, here's the plan. These are the next 3 steps you're going to take. You don't have respiratory issues, so don't worry about that. And you're going to be in good hands. And so that gave me sort of a sense of comfort that we've got a plan going forward for the next like few hours on what we're going to do about it. And even was reassuring of like, since I didn't have really serious respiratory issues, that that I wasn't about to get rushed to the ER or anything like that. So it was comforting and empowering to go through that experience.
I remember talking to you in the first couple days, and you were really passionate about, hey, when can we set up a camera and let's do some videos, because I really want to share this experience with everyone, all of our patients and our wonderful Zero community. And I was struck by that. Like, can you just recover? But you really felt that from the beginning. There's things that I'm learning that I want to share. And I guess I want to start with what most surprised you.
Yeah, definitely. Thanks. I wanted to get in front of the video and be able to share some of my experience with others. I was sort of, inspired by some other patients who had come out and talked about it so much and so openly. Most recently, Tom Hanks talked about his experience. As a CNN reporter, Chris Cuomo, who talked about his experience. So I was really sort of inspired by that to be able to correct some of the myths or the misnomers that are out there around the virus, because everybody's, we're sort of in, everybody talks about that going through this virus is almost like fighting a war. When you fight a war, there's this saying out there of there's the fog of war, where you don't really know what's going on, and it's hard to find good clarity on what the answers are in the moment. So I feel like that's what's still going on right now with the virus. And what I found most surprising, like immediately after my diagnosis, and not that I really got it, but I would say 8 to 10 people had reached out to me that said that they had also had, COVID, had already had it, or were going through it right now, and felt as though that they were getting shamed by other people. And that was really, it's kind of sad, because we're all, we're in this together, but separate, all, being safe, being in our own homes. But it's even more isolating when you have to go through this journey and feel like you're getting shamed from it. And some of the things that were shared with me from some others were that they had started to share with people in their family or their neighborhood, and automatically it turned to, oh, well, where did you go? Or did you not wash your hands enough? Or you must have done something to bring it upon yourself. So there's that. And then others got this, got this, got comments back that, that were like, well, we need to, stay away from you for a long time. And so people almost felt like, and we all, I think everybody read back in high school the Scarlet Letter, right? So everybody kind of felt as though that they were like going to be Hester Prynne over this, of having to have this sort of Scarlet Letter of having a coronavirus. So I was really surprised by that, and I just encourage people to keep speaking up, because talking about the virus, especially when it comes to those who have a already a compromised immune system, whether you've got cancer or heart conditions, or diabetes, and other comorbidities that we have to deal with. It's important to get the right message out there, and be talking about it.
I'm glad you shared that. I was really surprised by that. We've got enough going on, right? That's probably, we need less of that for sure. But, now as you go through your journey, you are a COVID-19 patient. Tell us what else you've learned, Jamie, because you've learned quite a bit.
Yeah, it was really interesting, and it's starting to some of it is starting to come out, but some of the things that I learned were, the advice that was given to me is, you unless you're having a really difficult time with your breathing, like if you're having a hard time finishing a sentence without catching your breath, if you're having a hard time walking across the room and can't catch your breath, then don't go to the ER unless it's absolutely necessary. Because if you've got, I've had multiple doctors and nurses tell me this last week, that if you're a patient with mild symptoms or even moderate symptoms, you can make it worse by going into the ER, because those places are really overtaxed and really overworked right now, and a lot of patients are in there, especially if you're in a state that's sort of a hotspot right now, which is where I am. Massachusetts, I think, has the third most amount of cases in the country right now. And my county leads the way in the number of cases that we have. But yeah, don't call unless you're gasping for air, like I said. Call your doctor and make a plan. Everybody's case is different. Just like a cancer case, everybody's COVID case is different. So call your doctor and get that set up. And we can, we're going to share a blog that goes along with this video too. And I've got a link to a site that I thought was really helpful to make a determination of what to do when I started coming down with symptoms. And I thought it was this great artificial intelligence site, which is probably also going to be on the uptick now that the world's a different place. And so we'll share the link to that. But I thought that was really helpful to be able to take in how old you are, what kind of complications are you having, what kind of symptoms are you having, and this is what you should do in terms of like quarantining yourself from everybody else, calling your doctors, or getting yourself to an ER as soon as possible. And when I started to feel better, I went back into that site and I was playing around with it and trying to imagine myself as a prostate cancer patient. As you know, the average age of a prostate cancer patient is over 60. So I put myself down as someone over 60 who has cancer, getting chemotherapy, and even putting all that criteria into the artificial intelligence site. It told me not to go to the ER, even with all of this, to call your doctor and make a plan for what to do, because they're doctors and researchers out there are really concerned about, as I said, overtaxing ERs and making symptoms worse. So if they can limit you from additional exposure, they do that. Another thing I thought was really interesting was I went in and they did the COVID test. They did the nasal swab where they try to hit the back of your skull with a giant Q-tip to get enough of the bacteria, whatever, on it to be able to test it, and the finger prick. But they also pulled a blood panel that they look at in terms of being able to determine if you've got inflammation in your body. There are certain different blood counts, things like ferritin, D-dimer, which is something that I've never even heard of, and then something called cardiac reactive protein test. I can't believe I just remembered that. But so those are three things that they pulled for me, and there was a couple of others too. But they're doing that right now. We're starting to do that across the country right now to be able to determine if your body has inflammation in a way that is trying to fight off the virus rather than being inflamed in a way that will cause respiratory issues. So what they're trying to do is predict increase in body inflammation that will lead in the next few days to respiratory problems. So they're trying to use that as a predictor of like, all right, we need to really keep a close eye on this patient and get him or her into a hospital, or in a setting where they can really take care of them, or if those blood levels are normal in a way that they can send them home and and really get better on their own over the coming days. So I thought that was really interesting. And I think that the third thing that I'll share is test accuracy, and that's actually just started coming out in the media yesterday. But talking to some of the doctors of their thought right now is that 30 to 40%. There's a 30 to 40% of false negative to the coronavirus test right now. So the fear is that you could go through this test and it can come back negative, and a doctor, and hopefully they wouldn't say this, they could say like, you don't have it, go back like you're normal, and go about your way of putting gas in the car and going to the grocery store and getting your essential things done that you need to while being at home, but not knowing that you have the virus, but then come back a few days later and then really present even stronger symptoms and test positive at that point. So there's some real concern and debate going on right now of the high false negatives that go on with the test. And I guess I'll share one more thing that I heard is that there's a debate going on right now whether how long it really takes for a patient to shut off some of the virus. We've all heard of, if you've got it, then you've got to, quarantine yourself for 2 weeks. But there's, talk and debate now that, especially looking at, countries in Asia where cases first started to come out, that that is taking longer than 2 weeks. It may take a couple of months for people to shed all the virus out of their system. So that's a little scary, I would say, to hear that, or a little concerning. So it's something that people should know about. But I'll say this too, is that while there's a sad impact of the number of deaths that have come out of COVID, particularly around people who have had either heart disease or cancer, prostate cancer certainly, and other comorbidities. But there's a lot of people surviving this too, and coming through on the other side. And so if we just trust in science and make our best judgments, then we'll get through, and together we'll beat this thing.
Thanks, Jamie. I learned a lot in what you just shared, and I think it's just helpful to be sharing that types of information because, as you said, there's a lot out there. So we're trying to help curate it for our prostate cancer community. Speaking about our amazing Zero community, which you and I have the honor of interacting with on a regular basis, when you went on your personal Facebook page and as part of letting people know what's going on, shared your diagnosis, you got a lot of great supportive comments. So I just wanted to ask you, what has been your reaction to the support that's come out from the prostate cancer community for you?
It was really moving. It was sweet to see. I had gone on to talk to a lot of our supporters and constituents and what we call our Zero champions, and the outpouring of support was just really moving and inspiring, and it was really nice and amazing to see, and we've got their back all the way, too. We have a program, as you know, called 0360. That is a patient navigator program that is free and comprehensive for all of our prostate cancer patients. And there's a lot of, as everybody can imagine, a lot of uncertainty right now around COVID, to be able to, should I go and get the treatment that I need? And I know that we've got another video that we're rolling out, that we're talking to our chair of our medical advisory board, Dr. Alicia Morgans, to talk about that. So that's going to be that'll be a great video for people to see. So that's going to be important to keep in mind. But on 0360 to call up and be able to get some advice of, like, should I go and get treatment? Should I go and get my biopsy done or get my scans done at this time, or can I wait and do it, revisit it a few weeks down the line? How urgent is that? We're also going to get an influx of folks, because there's it's a difficult economic time now too. There's a lot of layoffs going on across the country right now. A lot of and people losing their healthcare, unfortunately, who are also having to deal with prostate cancer. So, so being able to help out our patients and their families in that way is really important to not only the two of us, but to the whole organization, because we love our prostate cancer community, and we'll do anything for them. And for them to show that love back to us was really great. But we're here for them, and we're thinking of them, and we've set up a fund to help them out, right?
That's right. And I was going to end with that, because I think that people watching this do want to know how they can help. How can they help a prostate cancer patient who's really struggling? Like you said, we've seen unemployment, the claims skyrocket. We're in the millions now of people who have lost their jobs due to the COVID crisis. So the financial piece perhaps is not being covered as much, but is very top of mind for our community. And the 0360 case management program is the only program in the country dedicated specifically to prostate cancer patients. And we're already starting to see a spike in the people reaching out to that program. And we need to make sure that program can be available to be able to take that influx of patients that really need it. And so we set up our own Zero COVID support fund, specifically to help fund 0360. We were very lucky to have some generous donors who wanted to be there right away and set up a match. So it already started with $100,000, and we could make that 200,000. And so we kicked this off in the last 2 weeks, Jamie, and we've got a great response, but because people want to help.
Absolutely, and anybody watching this video can help out too. Any donation is significant, so even a small donation will go a long way for us to be able to get to that $100,000 match, and that's going to be able to help prostate cancer patients who are uncertain right now during this COVID virus outbreak to be able to get the care and treatment that they need despite the virus. And be able to get the help that they need around the financial picture, whether they've lost their health insurance or they need help with copay relief, trying to balance out mortgage payments with paying for the treatments that they need to go through, despite any kind of job loss or difficulties or furloughs that they might go through. So we're here for them, and we've got their back.
Absolutely. So if you want to donate, it's very easy. You just go to zerocancer.org. You'll also see opportunities on our social media to donate with one quick click. Makes it really easy. Well, thank you, Jamie. I think we had a lot of good discussion today. I think that our audience could definitely benefit from the insights that you had. This was really personal.
Yeah, thanks for sitting down with me, Colin, and to everybody watching. Please support a prostate cancer patient today, and donate at zerocancer.org /donate. And as I said before, we're all separate in our own houses across the country, but we're all together in this thing. And to everybody out there, stay zero strong.
Absolutely. Take care, everybody.
Thank you.
Bye.